Moving on to Phase 3, how do we get there and what can you expect? We speak to Professor Teo Ying from NUS.
A new study by KK Hospital, children under 5 are at the lowest risk of being infected by Covid-19 from adults.
And checking in with Trace Together, we answer all your questions about the app and token.
Hello, welcome to The Big Story, coming to you live from the Straits Times newsroom. I'm Olivia Quay.
I'm Haryanto Dimana. You can subscribe to the Straits Times channel so you never miss a single episode.
An update on the COVID-19 situation here. 12 new cases were confirmed today, with 0 in the community.
All were imported and had been placed on stay-home notices upon their arrival in Singapore. Now more details will be released tonight.
Larger dormitories can expect to be audited at least once a week. This as part of safe living measures and to minimize the COVID-19 infection rate in the dorms. The Manpower Ministry said the new infection prevention and control program will be rolled out to all dormitories, and it will target dormitory operators and staff, residents and MOM's forward assurance and support teams. While dormitories with 500 residents or more can expect to be audited at least once a week, the ministry said that audits for the other dorms will be done during routine inspections.
One of the key announcements from yesterday's COVID-19 Multi-Ministry Task Force press conference was Singapore's roadmap to enter Phase 3 of our safe reopening.
That's right. Well, Education Minister and co-chair of the task force, Lawrence Wong, said Singapore will have to keep its guard up and meet several key conditions.
To recap these conditions, well, first, Singaporeans will have to stick to safe management measures, including small group sizes, safe distancing, and exercising social responsibility.
Next, testing will be carried out on a larger scale to allow more activities to resume. For starters, a pilot scheme will see people undergo rapid COVID-19 tests before they're allowed to attend events.
And lastly, more venues will require people to check in using the Trace Together app or tokens.
Well, Health Minister Gan Kim Yong cautioned that Phase 3 is not a declaration of victory and we shouldn't go around celebrating and forget about the measures.
Professor Teo Ying joins us now. He's the Dean of the Saw Swee Hock School of Public Health at the National University of Singapore.
Now, Professor, according to the task force, this is what Phase 3 could look like. Gatherings outside homes could be increased to 8 people and 8 visitors could be allowed on home visits. Capacity limits in certain venues may be increased as well.
Is this how Phase 3 should look like then, Prof? Does this plan reflect how calibrated and cautious Singapore's reopening approach has been?
Thanks for having me. I think it's important to highlight that Phase 3 will not be a static phase, but it will be dynamic, very much like what we have in Phase 2. There's constant tweaks, there are changes to the rules we have, and even the way we implement some of these rules. And I think we need to realize that Singapore remains one of the few countries in the world where we have the chance to consider greater degree of reopening, of easing our measures. In many parts of the world, I'm pretty sure people realize that the situation has only gotten worse. So from the very beginning, we talk about the possibility of having repeated lockdowns, perhaps not nationwide, but definitely some sectors need to be shut again after reopening. We've definitely seen this happen in Europe, in North America, even in some of the countries in Asia Pacific like New Zealand, Australia, that have contained the situation very well. Singapore has been fortunate. We did not need to shut down again after reopening. And I think there's a reason for this. It's because we take small, cautious steps, experimenting what works, what didn't. Like the parks and the beaches, we need to implement registration for crowd control. And I think this is what I mean when I say that the situation will continue to change even when we are in Phase 3. Right now, of course, everyone is excited about having gatherings of up to 8 people. And of course, some will complain, why stop at 8? Why not more than 8? But I think at the end of the day, it is a choice we have to make. We open up too quickly, there will be a greater risk to much faster spread in the community because it can spread within a couple of weeks if there's a lot of easing and people are allowed to move more unrestricted in more unrestricted manner. If we open up cautiously, if there is a spread in the community, it happens slower and it's more manageable by our contact tracing, our testing, and our quarantine procedures. Certainly, it doesn't make sense to move to Phase 3 lifting only to return to phase 2, phase 1, or even a circuit breaker just a few weeks after.
Right. Well, Prof, many announcements from last night's press conference, but let's focus on the upcoming pilot program for pre-event testing. If it's successful and, of course, if all the other conditions are met as well, is this pre-event testing a dominant factor of how soon we can enter phase 3?
Well, I see this pre-event testing as one component of a suite of measures. So I don't see it as a dominant factor or a crucial determining factor, because people attending large-scale events will still need to keep to measures such as mask wearing, social distancing, some requirements on the venues and locations to properly handle large groups of people. So it isn't that we are now giving up all of these important measures just because we have pre-event testing now. So one important difference with pre-event testing, I think it's the proposed use of antigen rapid tests, which are cheaper, faster to deploy, potentially less accurate, but I think there is a two-stage protocol that we are talking about here, where people who are attending this will be tested with an antigen rapid test. Those who subsequently test positive will be confirmed with a PCR swab test.
Well, here's another condition laid out by the task force. More venues will require us to check in to safe entry using the Trace Together app or tokens. In fact, checking in with only the app or token will be mandatory by the end of December.
So this means we will no longer be able to gain entry to these places by scanning safe entry QR codes with phone cameras or through the SingPass mobile app or barcodes on the NRRC.
That's right. So, Professor Teo, we're also targeting to start phase 3 by the end of 2020. So, comparing both timelines, the phase 3 timeline and I guess the timeline or the deadline, so to speak, to start, the Trace Together, the mandatory Trace Together check-ins, should the Trace Together check-ins be brought forward to ensure that, we're completely ready to start phase 3?
Well, actually, in many workplace settings, Trace Together is already made mandatory. For example, I work in NUS. It is mandatory for me to have Trace Together downloaded and active on my phone. So the expected start on the compulsory use of Trace Together by the end of the year, actually, I believe it's to allow the distribution of the Trace Together tokens. And I see this as how Singapore usually works, to give you an early heads up on what is going to be required, necessary, so people can get ready, as well as the systems, including public spaces, can prepare. We're already near the end of October anyway, so this already gives us a sense when phase 3 could come in, perhaps in the next few weeks, provided that the adoption of Trace Together, whether it is through the mobile phone or whether it is through the collection of the tokens, can happen efficiently over the next few weeks. I think if we forcefully try and bring forward the deadline of adopting this use of Trace Together as an entry requirement to public spaces without giving people the time to adapt or to collect their tokens, I don't think that will be the right way to execute a national policy that will affect people's movement, everyone's movement within the country.
Right. Great points there, Prof. Thank you so much for your insights. Prof Teo will weigh in on border controls in a few minutes, so do stick around.
Well, but first, the Straits Times has had several questions about the impending national rollout of the Trace Together only check-ins, something we were just talking about.
So we answer some of your burning questions.
Okay, first question. Where will Trace Together only safe entry be implemented? The answer, all public venues where you currently have to check in with safe entry. These include workplaces, schools, places of worship, malls, restaurants, hotels, and healthcare facilities.
Now, when will Trace Together only safe entry be implemented? Mandatory Trace Together check-ins will be introduced first from now until mid-November at venues where activities involving larger groups of people take place. Other venues include those where live performances and business events are held, as well as places of worship conducting services with more than 100 people. The rest of the venues nationwide will follow suit by end December, when distribution of the tokens has been expanded further and everyone has access to either the app or the token.
Will trace together only safe entry apply to babies or young children? Well, all Singapore residents, I beg your pardon, 7 years old and above will need to use the token or the app to check in under trace together only safe entry.
You can collect your Trace Together token at 38 community centres or at 13 mobile booths deployed at various malls. You can go to any of these collection points regardless of where you stay. Now, the full list of locations is on the Token GoWare website.
Well, earlier today, experts from around the region, including New Zealand, South Korea and Indonesia, gathered remotely for a webinar to discuss border control.
Organised by the NUS Saw Swee Hock School of Public Health, panellists engaged in a wide-ranging discussion on how each country is dealing with the prospect of reopening. And moderating the panel was the school's Dean, Professor Teo Ying.
Well, Professor Teo is still with us. So, Prof, what were your main takeaways from the discussions with your regional colleagues?
I think one of there were three main takeaways actually. The first was really around how right now different countries have different approaches in terms of reopening their borders or even relying on flight restrictions, on quarantine, be it at home or at government facilities, using impact on health insurance or even the use of testing, different types of tests to manage people coming into the country. And I think one of the key takeaways is really around the need to harmonize some of this procedure so there is greater clarity and certainty for anyone looking to travel in different parts of the world. So, and the next is countries do need to take a more nuanced approach towards implementing some of these border control measures. A 14-day quarantine, it's a very safe approach, but may not be realistically required for some of the countries and territories that have the community situation very well under control, such as New Zealand, such as many parts of Australia, Hong Kong, Vietnam, Thailand. These are places where their situation is very well controlled. There is no requirement of a definitive 14 days quarantine. And the third is really around how can we make use of testing, whether it is antigen rapid test, whether it is the PCR test, or in Singapore, we have this new test on using breath analyzing to facilitate the reopening of borders that manages both to do so safely and yet allow people to come into the country requiring as little amount of quarantine as possible. Remember, safety is always paramount in all of these discussions.
Right. Prof, one of the big challenges in resuming air travel is coming up with a coherent policy that all parties can agree on. What did the panel have to say about that?
This was something that we did touch on as well, and it's certainly an aspect that there is a need for a global framework that to be established around recognizing who are the people that can be allowed to travel in a more unrestricted manner. Clearly, we know we have heard all these discussions around vaccine, and the WHO, the World Health Organization, has a COVAX facility that is looking at the equitable distribution of approved vaccines. The question now is not just on the distribution and the uptake of this vaccine. The question is, when people like myself, if I have received the vaccination, what certification is there to accompany this vaccination that allows me to move about in the world in a way that countries firstly recognize and respect this vaccine that I have received and allows me to enter the country in an unrestricted manner. So this requires a global framework to be established really to address and recognize, is there going to be a COVID-19 vaccination certificate or passport? Very much like what we currently have for yellow fever. There's a yellow fever booklet or certificate that you need to bring with you if you're traveling into any country that has that is endemic for yellow fever.
Well, Professor, let's move on. Singapore Airlines will start 3 weekly non-stop flights to New York's JFK International Airport in November, which will transport both passengers and cargo. But leisure travel to the US is virtually impossible, even discouraged at this point. So what is the significance of this announcement, you think?
Well, we will have to see what is the impact on travelers, because I believe there is a demand for travel, even to the United States, that perhaps will be addressed by having these flights made available, and now you can fly over to New York. But I think more important than that is really a signaling to the world, to IATA, the International Air Transportation Association, that Singapore is open for business. We are keen to really consider what are the precautions that need to be put in place to allow travel to resume in a safe manner. And this signaling immediately sends the right message that we are opening up a route to New York. And of course, we will manage the risk that comes with it appropriately. And yesterday's announcement, one of the important announcements was that in the past, if I travel to a country which doesn't have a bubble arrangement or a green lane arrangement, I have to forfeit my right to claim subsidized medical care. And that has now been lifted and made permissible. Meaning, even if I do travel to US, and in the event that I do get infected, at least I have the reassurance that Singapore will continue to take care of me when I come back in a subsidized care manner. And I think that makes a big difference.
Right. Well, thank you so much for your time today, Prof Teo. We've been speaking to Professor Teo Yik Ying, Dean of the Saw Swee Hock School of Public Health at NUS.
Also making local headlines today, according to a household transmission study by the KK Women's and Children's Hospital, children under the age of 5 are at the lowest risk of being infected by COVID-19 from adults, as they may be more resistant to the virus. The study result showed a transmission rate of 6.1% among children exposed to COVID-19 cases out of the 137 households surveyed. The adult-to-child transmission rates were similar regardless of the child's gender, and the risk of secondary infection in children were higher if the indexed COVID-19 patient was the child's mother.
An 18-year-old student pleaded guilty today to one charge of possessing obscene films on his mobile phone. He was among 4 men arrested last October in island-wide raids to bring down the SG Nasi Lemak chat group, which was used as a platform for sharing obscene photos and videos of Singaporean girls. 2 charges involving the sharing of obscene material were also taken into consideration.
The Workers' Party has filed a fresh motion in Parliament pertaining to the issues raised by a court case involving former domestic worker Parti Liani. In a Facebook post, WP said its chairman, Sylvia Lim, filed a private member's motion which was supported by fellow WP MP He Ting-ru. The motion states, quote, that this House affirms that fairness, access and independence are cornerstones of Singapore's justice system and calls on the government to recognise and remedy its shortcomings in order to enhance justice for all, regardless of means or social status, including facilitating a review of the justice system.
In the global headlines, Malaysia is allowing up to 10% of workers in states under its conditional movement control order to work in the office. Exemptions are given to those in accounting, finance, administration, law, planning and ICT. But they can only be in the office from 10 a.m. to 2 p.m. 3 days a week. Malaysia is battling its 3rd wave of COVID-19 infections with more than 800 new cases in recent days.
China defended its decision to give COVID-19 vaccines that are still being tested to thousands of people outside of clinical trials. The government said the move is justified given the risk of COVID-19 returning through its borders, as well as the lack of any significant side effects from the shots. In July, China authorized the emergency use of 3 locally developed vaccines to frontline workers, but that has since been widened to include employees of state-owned companies, and the government is also considering offering the vaccines to students heading overseas to study. The expansion has been criticized by experts, with some saying it was dangerous and a misuse of the program.
Amid escalating protests in Bangkok, Thailand received a group of tourists from China last night. Its first such arrivals since commercial flights were banned in April to combat the COVID-19 pandemic. Thai TV showed masked tourists exiting the airport with officials in full protective equipment spraying their luggage with disinfectant. Outside, some of the tourists donned face shields and put on rubber gloves as they boarded buses to their hotels. A second batch of 147 tourists from Guangzhou is due to arrive on October 26th, with more expected next month.
And in the world of sports, Manchester United recreated their Parisian heroics from 2019, this time edging out PSG 2-1 thanks to yet another late Marcus Rashford winner. It was United's second straight victory after a shaky start to the season. And manager Ole Gunnar Solskjaer was keen to stress that his team had finally clicked into gear ahead of a tough run of fixtures that sees them face Chelsea, Arsenal and high-flying Everton in the coming weeks.
Well, those are our top stories for today. For more news and videos, do visit straitstimes.com and remember to subscribe to our YouTube channel by hitting the red button below.
I'm Olivia Quay with Harian Tudman. Thanks so much for watching and we'll see you tomorrow on The Big Story.